The diencephalon forms the central core of the forebrain. It's surrounded by the cerebrum. It includes the thalamus, the epithalamus, and the hypothalamus. You have to think of the diencephalon as a box because it surrounds the third ventricle. The thalamus makes up the walls of the third ventricle. It sorts all of the sensory input that comes to the cerebrum. Impulses from the hypothalamus go through here for the regulation of emotion and visceral function. Impulses from the cerebellum and the basal nuclei go through here to help direct motor cortices. And impulses for memory or sensory integration go through here. The thalamus helps mediate sensation, motor activities, cortical arousal, learning, and memory. The hypothalamus makes up the floor of the third ventricle. The infundibulum is a stalk of tissue that connects the hypothalamus to the pituitary gland. The hypothalamus is the major homeostatic center. There is no blood-brain barrier in this part of the brain. It controls the autonomic nervous system, regulates body temperature. It's the center for emotional response. Your pleasure, fear, and rage centers are located here. Satiety, that feeling of fullness, thirst, and sleep-wake cycles are also controlled here. And this is the controlling system for the endocrine system. Hypothalamic disorders have a broad range of disorders. Anything from severe body wasting to obesity may occur. Sleep and dehydration disorders can also occur. Various emotional disorders may be the result of hypothalamic disorders, and this has been implicated in failure to thrive. Children who are deprived of warm, nurturing relationships do not develop. They don't grow. They don't develop emotionally. We sometimes see this in orphanages. The epithalamus is the roof of the third ventricle. Here we find the pineal gland, which secretes the hormone melatonin. Melatonin helps regulate our sleep-wake cycles. Also in the epithalamus is a large choroid plexus. This is a large cluster of blood vessels that is involved in the formation of cerebrospinal fluid. The brainstem has a similar structure to the spinal cord, but it does contain nuclei embedded in its white matter. It helps control automatic behaviors that are necessary for survival. It also contains fiber tracts that connect the higher and the lower neural centers. There are three parts to the brainstem: the midbrain, the pons, and the medulla oblongata. The midbrain houses centers for auditory and visual reflexes. These are in the corpora quadrigemina. The visual reflex center is what makes you turn when you see something out of the corner of your eye. The auditory reflex center is what makes you turn when you hear something. The word pons means bridge, and the fibers of the pons connect the higher brain centers and the spinal cord. They help relay impulses between the motor cortex and the cerebellum. The pneumotaxic center is located here. This center is involved in maintaining breathing rhythms. The medulla oblongata has a ridge known as the pyramids where the motor cortex neurons cross. Crossing is called decussation. Also, the autonomic reflex centers are located here. This function overlaps with the hypothalamus. The hypothalamus relays instructions via the medulla to the effectors of the autonomic nervous system. The vital centers located here include the cardiovascular system, which controls the rate and force of heart contraction, the vasomotor center, which controls the blood vessel diameter and thus controls blood pressure, and the respiratory center. This controls the rate and depth of breathing and the basic rhythm of breathing. Some other centers include the vomiting center, coughing, sneezing, swallowing, and hiccuping. The cerebellum, like the cerebrum, is separated into hemispheres. It processes inputs from the cerebral motor cortex, the brainstem nuclei, and the sensory receptors. The cerebellum controls the precise timing and the appropriate pattern of skeletal muscle contractions so that we get smooth, coordinated movements. Also, subconscious activities such as writing your name is housed here. Once you learn how to write your name and you start that first letter, you tend to just automatically write it without thinking of it. The cerebellum is responsible for that. The cerebellum shows synergy. That is, it coordinates the agonists and the antagonists so we get that smooth, coordinated movement of muscles. Ataxia is when you have a lack of coordination or a clumsiness. One of the things that happens when you're pulled over for a DUI is they ask you to touch your finger to your nose. You can do this pretty easily if you're not alcohol impaired or you don't have ataxia. An inability to do this could be as a result of cerebellar damage. Dyskinesia is when the cerebellum allows involuntary movements to occur, tics or chorea, flapping of your arms and legs. Functional brain systems are networks of neurons that work together but span wide areas of the brain. This includes the limbic system and the reticular formation. The limbic system is a group of structures collectively working together between the cerebrum and the diencephalon. We call this the emotional brain. One of the things it does is it links emotions to odors. You think that cinnamon rolls smell good and skunks smell bad because of this link. It also helps you recognize angry or fearful facial expressions. It assesses danger and elicits the fear response. It plays a role in how you express your emotions using gestures, and it resolves mental conflict. The limbic system also plays a role in memory. The limbic system is where feelings and thoughts are interrelated. This is what may be the cause of psychosomatic illnesses. With psychosomatic illnesses, people have real symptoms, but there's no organic cause for the symptoms. Rather, their feelings or their thoughts are causing the symptoms. Stress, for example, can give people headaches or heart palpitations. The reticular formation is the alert part of the limbic system. This goes through the central core of all of the brainstem structures. The reticular activating system, or RAS, sends continuous impulses of information through the thalamus to the cerebral cortex. This keeps it alert and conscious. It also helps filter out familiar or weak signals, which are about 99% of all the stimuli that come into the brain. The RAS is inhibited by the natural sleep centers of the brain, by alcohol, and by drugs like tranquilizers. If damaged, it can result in permanent unconsciousness or coma. There are numerous higher mental functions. We're going to look at just a few: language, memory, brainwave patterns, consciousness, and sleep cycles. There are two major language areas in the brain, Broca's area and Wernicke's area. These are both in the association cortex and tend to develop on the left side of the brain. These areas help analyze incoming word sounds and have them make sense, and helps you produce outgoing word sounds and grammatical structures. In other words, it helps you choose the words you're going to use and the order in which you're going to use them. If Broca's area is damaged, you can understand language, but you can't speak. You can still write, type, sign, you can read, you can understand what's coming in, you simply can't speak. If Wernicke's area is damaged, you can speak, but you can't choose the words you want to choose. You speak nonsense. The corresponding areas on the right side of the brain are typically involved in non-verbal language components like body language. However, if Broca's area or Wernicke's area are damaged, with therapy, the right side of the brain's areas can take over those functions. Memory is the storage and retrieval of information. Your memories reflect your entire lifetime. There are different kinds of memory. Declarative memory is the memory of facts, names, faces, words, dates. Procedural memory is the memory of skills, learning to play the piano, for example. Motor memory is the memory of motor skills, riding a bike or swimming. And emotional memory is the memory of experiences linked to an emotion. How happy you were when you graduated, how sad you were when a parent died. That's what your emotional memory is. We have two forms of memory. Short-term memory is limited. Only 7 or 8 bits of information can be stored in there at a time. But this is your working memory. It lasts seconds to hours. Incoming sensory input can be stored in short-term memory until you decide what you want to do with it. Long-term memory has limitless capacity, but it can be forgotten. It's probably not really forgotten, you just can't find it anymore. This is where information from short-term memory is stored if you intend to hold on to it. The ability to store information and to retrieve it declines with age. When you're transferring short-term memory to long-term memory, there are some things that play a role. One is your emotional state. This transfer occurs best if you're alert, motivated, surprised, and aroused. Sometimes the emotional state helps you remember a day you would not normally remember. You may remember 9/11/01. It was a regular old Tuesday, but because of the events of that day that were very emotional, you probably remember a lot about that Tuesday that you don't remember about the Tuesday before or the Tuesday after. Another thing that helps you transfer from short-term memory to long-term memory is rehearsal. This is repeating or practicing. That is, you put the information in long-term memory, you go look for it, you bring it back into short-term memory for a little while, you put it back in long-term memory, you pull it back out and think about it, you put it back in long-term memory. The more times you pull it in and out, the easier it is to find it when you want it. Association of old memories to new memories helps. So tying new information to old information that you already have in long-term memory helps hold that short-term memory in long-term memory. And then we have something called automatic memory. This is sort of extraneous information. It's usually not important to what you're trying to remember, but it's stored in there with your long-term memories. Memory consolidation is when we get that memory transferred to long-term memory. We fit the new facts into categories that we already have stored in the cerebral cortex, and this provides us with permanence of that memory. Repeated feedback will transform the new perception into a more durable memory. We access the memory through the same cortical neurons, so it's sort of like building a path. You start blazing a path when you put the material in long-term memory the first time. Every time you go and get it, you make the path a little more visible. You make it a little easier to find where you're going. Our outside stimuli come in through our general and special sensory receptors, and this is temporarily stored in our cerebral cortex in sort of a buffer area. Some of this we decide to dump right away. The rest of it goes into our short-term memory. Now, if we decide not to keep our short-term memory, we forget it and we lose that data. But if we decide we want to keep it, we transfer it to long-term memory, taking into account that excitement, rehearsal, and association will help us get it into long-term memory easier. We will take it out of long-term memory and put it back in short-term memory when we need to answer a question on a test. We'll put it back in long-term memory. When the final comes along, we'll pull it out again. We'll put it back in long-term memory. We may not have to access it for a long time, but at some point in time, we'll want to bring that back out into short-term memory. The more times we do that, the more permanent the memory becomes. Long-term memory may become unable to find. It's not really gone, we just can't retrieve it. In that case, we have lost that data. If we can't find it, we've lost it. Now this automatic memory, this is stuff we remember that we don't really need to remember. When I took embryology, I had a teacher who wore the most outlandish ties. And sometimes when I was on a test, pulling information from long-term memory into short-term memory to answer a question, I would also pull up the tie he was wearing that day. I'd get a very distinct picture of whatever tie he was wearing the day we discussed that in class. Homeostatic imbalances of memory can be just a slight memory loss. This occurs if there's damage to the hippocampus or some of the other temporal lobe structures involved in memory. If there is destruction of the hippocampus and the amygdala, the two areas most involved in memory, we have the condition of amnesia. Anterograde amnesia occurs if no new memories can be formed. These people live in the moment. Now, all of their consolidated memories are still there. They can remember things that happened before the accident that caused the brain injury. They just can't remember anything for very long after the injury. They'll ask the same question over and over and over again. Retrograde amnesia is when you lose memories that were formed in the past. You have the ability to form new memories, but your old memories are gone. Electroencephalograms can give us an idea of what our brain waves look like. This is a record of neuron activity. Brain waves are simply the pattern of electrical activity, and they're as unique as fingerprints. There are 4 types of brain waves. In alpha waves, the brain is idling. You're calm, you're relaxed, you're awake, but you're not taking in any sensory input. You're not hearing anything, you're not seeing anything. These waves are regular and rhythmic. Beta waves, they're still rhythmic, but they're not as regular. You have a higher frequency, that is, the waves are a little taller. You're mentally alert and you're using your brain, you're problem solving, you're taking in visual stimuli. Theta waves are more irregular. They're fairly common in children, but they're abnormal in awake adults. They have an erratic pattern to them. And delta waves are very high amplitude waves. These are seen during deep sleep. If you're awake and you see delta waves, this is an indication of brain damage. So here you see alpha waves, awake but relaxed. Beta waves, awake and alert. Notice how they get a little more irregular as you think about things. Theta waves, slightly higher amplitude, fairly common in children. And then these delta waves. Big waves here. The active brain, you have complex low amplitude waves. In the inactive brain, sleep, for example, you have the higher amplitude waves. The neurons are firing more together. If you have a flat EEG, that is no waves at all showing, you have an indication of brain death. Epilepsy is a condition where there's an abnormal electrical discharge by groups of neurons in the brain. In some instances, we don't know the cause. Other individuals have developed epilepsy after brain injury or tumors. Victims of epilepsy may lose consciousness. They fall stiffly and they have uncontrollable jerking movements. Epilepsy is not associated with any kind of intellectual deficit. About 1% of the population has epilepsy. In some instances, the individual experiences an aura, a sensory hallucination that happens just before the seizure activity. There are basically two types of epileptic seizures. Absent seizures were formerly known as petit mal seizures. These are fairly mild seizures that are seen in young children. Their expression goes blank for a few seconds. They sort of stare off into space. This is sometimes triggered by flickering lights. Tonic-clonic seizures, formerly called grand mal seizures, are much more severe. They last for a few minutes. These are the ones that are most likely to have an aura precede them. The victim will lose consciousness. They may break bones because of the intense convulsions. They may also lose control of the bowel and bladder. Severe biting of the tongue sometimes occurs. There are a number of anticonvulsive drugs available to assist in the control of epilepsy. There are also vagus nerve stimulators or deep brain stimulators that can be implanted near the vagus nerve or in the brain. These will deliver pulses to the vagus nerve or directly to the brain to help stabilize brain activity, sort of like a defibrillator for the heart. Consciousness involves the simultaneous activity of the cerebral cortex areas, all of them. This is your perception of sensations, your voluntary initiation and control of movement, and all of the higher mental processing, memory, logic, solving problems. It's a continuum of activity. Alertness is the highest state of consciousness. Drowsiness or lethargy precedes sleep. Sleep is a normal form of unconsciousness. Stupor is a pre-coma condition. It's deeper than sleep. It's very hard to rouse people if they're in a stupor, and they always seem dazed and confused. And a coma, this is the lowest form of consciousness. Here they're unresponsive to stimuli. Any form of unconsciousness, with the exception of sleep, is a sign that the brain is not functioning properly. Syncope or fainting is a brief loss of consciousness. This is due to a loss of oxygen to the brain. Low blood pressure may be the culprit or some sort of decreased blood flow to the brain. Fainting is really kind of a protective mechanism. When you pass out, your head goes lower than your heart, or at least to the same level as your heart, and this allows blood to easily get to the brain. With a coma, the individual is totally unresponsive to stimuli. Brain oxygen use is below that of resting levels, and brain activity is lower than sleep. Causes can be blows to the head, tumors, infections, metabolic disturbances like hypoglycemia or drug overdoses. With brain death, you have an irreversible coma. Here the brain has been damaged irreparably. Medical decisions are necessary if the individual is to be removed from life support devices. Sleep is a partial unconsciousness. Cortical activity is depressed, but brainstem activity still continues, so your heart still beats, you still breathe, things like that. There are two events that occur during the sleep cycle: non-rapid eye movement sleep, or NREM, and rapid eye movement sleep, or REM sleep. Sleep is an alternating pattern between NREM and REM sleep. We can define the cycles by their EEG patterns. When you're awake, you have those alpha and beta waves. As we go into REM sleep, your skeletal muscles become inactive. Everything except the eye muscles, because your eyes are going to be moving, and your diaphragm, because you're going to be breathing. Most of your dreaming occurs during REM sleep. NREM has 4 stages to it. You start out relaxed, fairly easy to arouse. You go deeper. You see these sleep spindles, these little bursts of activity here. Arousal is a little more difficult. Then we start seeing the delta and theta waves of stage 3. The vital signs decline during this stage, much harder to awaken. And when you get into NREM, your delta waves are the predominating EEG wave you see. This is very difficult to come back from. Bedwetting will occur in this stage. If individuals have night terrors, this is when they will have them. And for sleepwalkers, they're in stage 4 in REM when they sleepwalk. With REM sleep, the waves look a lot like alpha waves on the EEG. There's an increase in body temperature, heart rate, blood pressure, and respiratory rate, and a decrease in gastrointestinal motility. The brain uses more oxygen than when it's awake. The eyes move rapidly under the eyelids, hence the rapid eye movement name for this stage of sleep, and the skeletal muscles are limp. This is when most of your dreaming occurs. You alternate between NREM and REM sleep. NREM stages last about 90 minutes, and REM stages last between 5 and 10 minutes, increasing in length with each time you go into REM. The last REM period usually lasts between 20 to 50 minutes. Your longest dream occurs just before you wake up. Here is a typical sleep pattern. You start out awake, you go into REM sleep, then you start into NREM, stage 1, stage 2, stage 3, stage 4. You come back up, go into REM sleep for a little bit of time, go back down, come back up, spend a little more time in REM. This time you may not go all the way down to stage 4. Come back up, longer in REM, go back down. Again, you don't go quite as deep in REM sleep. Come back up a fairly long time in REM sleep, down to light sleep, back up, and then awake. Sleep is very important. During the NREM periods, you're restoring brain tissue. You're allowing various chemical things to reset. REM sleep is needed to help clean your cortex. Meaningless information is stored in there and you need to get rid of it. If individuals are deprived of REM sleep, they become moody and depressed. REM sleep gives the brain an opportunity to sort of look at the day's events, work through any emotional events or problems. Sometimes when you sleep on a problem, in the morning you have the solution. That's because of your REM sleep. Also, REM sleep allows you to eliminate any unneeded synapses that were formed. In other words, you sort of dream to forget certain things. Alcohol and sleep medications suppress REM sleep, but not NREM sleep. Since that's the restorative sleep, it's important that you get that sleep. Infants need 16 hours of sleep a day. Adults need between 7.5 and 8.5 hours of sleep a day. As you age, your time in stage 4 sleep declines. Older people are sometimes referred to as light sleepers. They may never get into stage 4 sleep, or if they get there, they don't stay very long. Narcolepsy is a sleep disorder where people suddenly drop into sleep from an awake state. They sleep for about 15 minutes. Episodes may be triggered by pleasurable experiences. Often these individuals have cataplexy, that is, they have a sudden loss of voluntary muscle control. Orexins are chemicals from the hypothalamus that help keep us awake. It appears that people with narcolepsy have these destroyed by the immune system, but orexins are a possible treatment for narcolepsy. Insomnia is a chronic inability to either obtain the amount of sleep you want or the quality of sleep you need. This may be treated by blocking orexin action. Sometimes this is age-related. Older people tend to have trouble sleeping. People who travel may experience jet lag, particularly if they cross a number of time zones. And sometimes stress or other psychological factors contribute to insomnia. Sleep apnea is when you temporarily cease breathing while you're asleep. This is going to cause tissue hypoxia. Alcohol, high blood pressure, obesity, and tonsillitis can all contribute to this. Sleep apnea also tends to occur more frequently in older people. This can be treated with surgery or constant positive air pressure machines, CPAPs. Because of the hypoxia, this can contribute to other medical problems. People who experience sleep apnea are at a much higher risk for heart attack, for example.